Hi everyone, welcome to the show. It's Wednesday the 4th of November, and how old are you? I'm 45, in case you think that's a rude question. Had this been the Middle Ages, I would probably have been dead for about 15 years now. Yes, life expectancy at birth in medieval Europe was the grand total of 30 years. 30. Now it's more than 2.5 times that. In our neck of the woods, for example, life expectancy at birth sits at 80 years now. That's almost 10 years on only 3 decades ago, and that's at birth. Once you pass the trials and tribulations of your teens, it gets higher. And so the developed world is occupied by ever greater numbers of people who would have seemed pretty alien in medieval Europe. In fact, in 19th century Europe, elderly folk living rich and full lives into their 80s and 90s, numbers unprecedented in human history. And that's just one of the changes our health system is having to cope with. Urbanisation is another one. When we built our modern hospitals, a far greater percentage of us lived in provincial towns. Now, a third of all New Zealanders live in the Greater Auckland area. So what next for the New Zealand health system? Gareth Morgan, in this provocative little book, Health Cheque, co-authored with Jeff Simmons, argues it too needs some medical attention. He joins us live from Wellington now. Gareth, it's great to have you on the show. Boy, you're throwing the cat amongst the pigeons with this book. But in short, you believe, I guess, our expectations of our health system are simply too high, right?
Yeah, I mean, that's the issue, John. It's the public. It's like the genie's out of the bottle, and they keep growing, and every time that there's a new procedure comes along, we all want it. And so while the new procedure might be cheaper than the old procedure, it's outweighed by the fact that the demand for it from our, either from us or from our agents, which are the doctors, just explodes, and we end up having to spend more money on that condition than we did before. So health systems right through the first world face this problem. It's not just a New Zealand issue. But unfortunately, we are trying to drink champagne on a beer budget, because our incomes and our tax clique that funds this monster are slipping relative to the OECD, but man, our expectations aren't.
And as the baby boomers get older and we have fewer and fewer children, in fact, the burden on the taxpayer becomes greater, doesn't it?
Well, it does, because a very large proportion of your lifetime's health care is spent in the last couple of years, and there's going to be a lot more of us, so that's going to put the stress on. So we're spending 9 cents on the dollar now of what we all earn together on health. By 2050, it'll be 18 cents. I don't think you want to spend 18 cents of every dollar you earn on health. So okay, where's it going to break?
Well, let's talk about what we can do. One of the things we've got to acknowledge is the consolidation of populations in fewer areas. And so we have an enormous number of hospitals around New Zealand. You say, and I quote, the level of service in the smaller DHBs is poor. Do we have to get tough and unsentimental and rational and close some of these hospitals?
Yeah, I mean, this is one example of how politicisation of the health system is impeding its progress. And so everybody wants a hospital on the nearest corner, right? But the problem is not all hospitals are the same. And you need a critical mass of surgeons, of nursing staff and all the rest of it. And what's happening is it looks like a hospital, it feels like a hospital, it costs like a hospital, but it's not a blimmin' hospital.
That's right.
And the amount of care you actually get there is not comparable to what you could get in the city. So who's fooling who here?
This is a good question. The other question we have to talk about is care for the elderly and the difference between palliative care and giving people a death with dignity and prolonging life in circumstances which are what? I mean, you explain this because, boy, this is an unsentimental equation, isn't it, Gareth?
Yeah, this is tough, this stuff. Basically, people are living past their use-by date. That's the reality of it.
And you're not... sorry, I want to interrupt here because that sounds glib, but I know from having read this, you're not being glib.
No, I'm not, because they demand a lot of money in those last few years, and that's money that is not being spent on preventative health, where we actually get 4 times the return than we do on spending on end-of-life as a nation, and it's not being spent on early intervention, and it's not, by the way, John, being spent on Maori and Pacific Island, who have increasing chronic conditions and they are slipping through the system. And I don't think as New Zealanders we can be proud of that.
And they still have shorter life expectancies than the rest of the population, which we should also not be proud of.
No, they're not getting a good deal. They've got problems with access. I mean, I've noticed when I was in the hospitals in South Auckland and that, they haven't even got the money to spend the bus fare to get to care. So, you know, some of these people are living 8 in the garage and all the rest. They get chronic conditions. And if you allow that to go, what happens is you end up spending so much more money at the end of the day because they have a multitude of conditions that you've got to deal with. And it's not only that, there is some evidence, it's arguable, but there's some evidence is when you get them in the system, they still don't get equal treatment. They end up in general wards as opposed to in the specialist areas where they should be for their... So there's serious issues there. The squeaky wheel here is getting the buck, John.
And the squeaky
wheel are the old white folk, I'm afraid.
OK, so we have to have a dispassionate, rational, intelligent discussion about this, which means removing it from politics, doesn't it?
Yeah, absolutely. And this is not hard from an economic engineering or medical engineering point of view. There are criteria you apply as to how you will ration money across... It's a fixed amount of money, right? So money across treatments and then within the treatment from the most urgent case to that. This is not difficult stuff. But the politicians, unfortunately, choose at all levels, local and national, to politicise the system, and it's being gamed. I mean, if you want to get up the queue, John, go to ACC. They'll get you up the queue bloody fast because they don't want your cost. Or go to A&E. That'll get you up the queue. And there's even companies that will charge you money to advocate for you. This is not right. This is not equitable.
Gareth Morgan, whose book co-authored with Jeff Simmons is called Health Check. Really good read. Thanks so much, Gareth, and there really are discussions we need to have.